Hey, John, you're good.
All right. Hello and welcome to the January 5th regional report out call for Southwest Kansas and this region. We'll be here every week at 4 o'clock live on this YouTube channel. And I just want to encourage you to sign up with your email address if you want this sent to you, a link to this conversation and the dashboard as soon as it wraps up every week so you can consume it at your own time. COVID, this is where you sign up, sorry. covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. We'd love to get you signed up on there so you can get the information every week. I'm John Rolfe. I'm your chair for these calls. And let me start by going to our dashboard that our friends from the Kansas Hospital Association generously put together for us every week. My mouse is acting really funny. Okay. Which screen are you seeing? Do you know which screen? Are you seeing the dashboard?
Yeah.
Okay, perfect. So if you look here, 100% of hospitals reporting, only one showing a staffing shortage, but there was a issue when the year changed over that was not something that hospitals had to fill out, and so it got auto-filled as no issues. That's something that I think next week we'll have a more accurate count for. So that's off this week. But coming across here, there's 22 adult staffed ICU beds in the region, 5 available. This is as of yesterday. A dynamic fluid environment that gives us a 23% as far as the capacity goes. And 54 confirmed or suspected COVID patients inside the 18 hospitals reporting here in the region. You also see what, northwest and southwest parts of the state are seeing the best kind of curve here. Had that really bad spike in November. There's a drop in testing over the holiday that you can see here, started to pick back up this next week. But we saw a lot of places where this particular line here was back up to where it was 4 or 5 weeks ago. So that's positive for Southwest Kansas also. Still higher than anybody would want, but certainly trending better than where we were in November. And then here on the second page, you can see the county layout of Southwest part of the state, the percent of the population that's tested positive, and then COVID patients versus non-COVID patients in the ICU and the available beds. Again, that's a static number taken out of what's a dynamic environment. So that is our dashboard for this week. And then I also pulled from KDHE's site, according to them, the week December 27th to January 2nd, there's 11.2% positivity rate for the region on the testing. So with that, let me come back to you here and toss it over to Teresa. Teresa, are you giving us a report from the public health side?
No.
Oh, sorry, wrong person here. Well, Jeanette, there she is. Jeanette, are you with us?
I am.
All right. Sorry about that, Teresa. Jeanette, can you give us just an update from the public health side?
So, for most public health departments, we're, gradually seeing an increase in cases from the Christmas break. So, people are starting to get tested again and just seeing an increase in cases like we kind of expected. And then, of course, we have 101 questions and people calling about vaccinations. So, the public is hearing that the vaccine is out there and they're wondering when they can get it. So we're trying to follow KDHE's guidelines about, getting the healthcare workers, first responders vaccinated first. And so we're, making lists and trying to push, reassure the public that it's coming. It's just not quite their turn yet. So, and that's about all I have.
Thank you, Jeanette. And I'll add to the vaccine conversation. Had an opportunity to talk to KDHE this morning. And they were indicating that I know they're working on a website that will be a good central point of information for the public around the vaccine. And then I believe the governor is going to roll out kind of the stages of the vaccine later this week. So something for us to all be looking for and listening for. And I know, hospitals and health departments have really been doing a pretty efficient job of getting that vaccine rolled out. Kansas was one of the few states in the country that had a very quick distribution model out to every county in the state. So we got the vaccine out to all 105 counties. And I think there's a system issue with the reporting system back up to feds that had Kansas looking so bad on that first report. Sounded like even some larger healthcare systems were having trouble getting the information entered. So it is out there. It is in short supply in most places, and it sounds like most of January would be working on getting the frontline workers vaccinated before it gets out to the public to level set there. Jeanette, anything else you'd want to add before I pitch it over to the hospitals?
Nope, that should be it.
Okay, thank you, Jeanette. Mary, can you give us a hospital perspective? What's going on?
Yes, good afternoon. My name is Mary Adam. I'm the director of the Pioneer Health Network, and I'm representing the 18 counties in the Southwest region for this call. John went over the dashboards, and as I'm sure the other regions have shown, testing numbers were down over the last 2 weeks, which kind of skews the numbers because of Christmas and New Year's. But I think that we're probably going to be seeing an uptick in numbers. I know that in Finney County, our numbers are climbing up as of today's counts. And as the testing increases, those numbers, unfortunately, I think will increase. Our hospitals in the region, as Jeanette said, they're busy administering the second dose of the Pfizer vaccine, and they're also receiving the first doses of the Moderna vaccine, which both could take considerable time in facilitation of getting those vaccines and administering them. Facilitating that whole process is very time consuming, and the time taken just to give the medication and to monitor the patients, it's one more thing that they have to do. And as much as they enjoy and are happy to have that vaccine available, it's something else that adds to their workload, which we need to recognize and respect. And I want to give another mention of our long-term care units. I think, in the larger hospitals, they do not have long-term care units, but many of our small critical access hospitals in rural Kansas also operate a long-term care facility. And that is a whole nother bag of worms for our healthcare workers to handle and deal with through this crisis. And I just want to give a shout out to 2 of our hospitals with long-term care units have achieved an amazing accomplishment of 0 positive residents after months of ongoing testing and state surveys, with their residents now being out of isolation and quarantine, which is huge for those residents that they need the interaction more than anyone. And so I'm so proud of them, and I'm so glad for these hospitals, these staffs that have achieved these results. Some of the smaller facilities are just now receiving their Regeneron and bamlanivimab. I can't say that, the BAM. So they're now administering those medications to those patients that are not severe enough to be inpatients with their COVID symptoms, but they are severe enough to require some sort of treatment. So they are glad to be able to start treating that population in the small facilities and communities as well. I have noticed, and I hope this does not continue, but I've just noticed in the Finney County numbers here in Garden City that our death rate has increased. We had 7 over the last 2 weeks that were documented on the Finney County website. So, that uptick is concerning. I think the acuity level of the patients is definitely part of that. And I hope that does not continue. So with no further ado, I want to introduce our 2 ground report presenters. I'm so honored and blessed to have them join us. And actually, there'll be three. They're all from Wichita County Health Center, which is a small critical access hospital in Leota, Kansas. Very caring, compassionate, quality care that they provide there. In addition to an acute care, they also have an emergency room, and they also have a long-term care facility. And from there, we have with us today, Dr. Julia Myers. Julia Myers is the Chief Medical Officer and has been at Leota for 17 years. And Taya Beckman is a nurse practitioner, APRN. She's been with Wichita County Health Center for about a year. We also have Teresa Clark with us, and Teresa is the CEO of Wichita County Health Center. So we have a great representation from the facility, and I'd like to turn it over to them to give their reports on what's going on in Leota.
Well, thank you for having us. We were asked to talk about some of the challenges we're facing and some of the positive things we've seen through the COVID situation over the last nearly a year now. I would say shortages of getting the things that we need has been the biggest challenge throughout. From staffing, when we had staff that were out sick with COVID, having enough PPE to protect our staff, getting rapid testing. It's better now. We have received some rapid tests, but there are still issues. We have a PCR machine, but we can't get any of the reagents to use it. So most of our testing still has to be a send out with at least a 2 to 3 day time before we know results on outpatients. And of course, with the BAM and the other things, that's a very time sensitive treatment option. So that's a challenge, figuring out how to deal with that. It seems like we had kind of an outbreak in our nursing home, and about as soon as it was over, we started getting the rapid testing and more equipment. So getting the things that we need at the time that we need them is an issue. If we'd had the monoclonal antibodies before our nursing home residents started getting sick, who knows, but maybe we could have prevented some significant illnesses or deaths. We had a couple of COVID deaths in our nursing home, and that has been a big challenge in a small community where people are taking care of their friends and neighbors and maybe people that they've known for decades. We get pretty attached, and when people who had been very active, healthy, mentally sharp, when they're the ones that get taken, that takes a big emotional toll. Ongoing right now, probably the biggest challenge is we're a small facility. We have 2 ER beds, 10 acute beds. And when we have patients who need a higher level of care, the last transfer I did, I spent 2 hours making phone calls before I found a facility that was able to accept the patient. And the larger facilities, it's not that they don't want to help. Several of them said, we're on divert. If you could keep the patient overnight and send them in the morning, or you could check back this afternoon because we might have some beds open up. But that, is hard when you have somebody who needs to get someplace now, and it's at least an hour or two transfer, transportation time. Once you add a couple more hours trying to find a place who's able to take the patient, that's a significant issue. And just getting COVID vaccine. Some of us frontline healthcare providers have been able to get the vaccine because it was shared by a neighboring larger hospital, but our hospital still hasn't gotten any of our own vaccine for our providers, nurses, frontline people. As far as positive things that we've seen, we've had some good support from some of our community. we had to shut down visitation to our nursing home residents for quite a while with the outbreak, but our staff and family members got creative in figuring out ways to, visit through the windows or outside, across the patio. And our staff really did their best to keep the social well-being of our residents in mind and do the little Christmas things that family often do but weren't able to get in and do. We've had community members make treats and goodies for the staff and make cloth face masks to help out. And just the tight-knit group of us that work here have been good support for each other, even though it's hard and it's tiring, but we're finding ways to look out for each other and take care of each other.
Agreed. I'm with Dr. Myers. I help cover the emergency department, and the hardest thing is having a patient that needs advanced care beyond what we can provide ideally, and you can't find a place to send them. And it's not necessarily a COVID positive patient. It could be a patient with a different process that needs to be addressed surgically or a cardiac situation, and they're sitting in your ER getting sicker and you can't get them out the door. It gets to be a little stressful because they're people you know and you've met, and they're looking at you like they know you're going to get it done, and you're like, I'm not sure if I will. So it gets to be pretty tough.
Thank you both very much. Teresa, do you have anything that you'd like to add? John, do we have a couple minutes?
Yeah, Teresa, that's fine.
No, I mean, I just want to tail on to what them guys are saying. The challenges have been difficult with the staffing and, and watching our loved ones go through this, and it's been hard.
Thank you, Teresa and Julia and Tara. It's Tara, right? Did I get that right? Yeah. Okay.
Yeah.
It's just so helpful to hear what this is like, and the story you're telling is happening in a lot of places, I think, around the state, and particularly in these smaller communities where you do know the people, and you're trying to get them to some place that has more advanced care, like you said. And we have Dr. Watson here with us from Cheyenne Mountain Software. He's got some live dashboards to show us, just to help highlight what's going on with that transfer situation. Dr. Watson, do you mind sharing that?
Yeah, no, and I'll say that that's been our job, is to provide mission control software to small hospitals, and then staff to actually help make the calls and take the burden off. So definitely, and honestly, I'll have somebody contact you. I want to make sure that we reach out to you guys, and it's the service the state is providing for people to be able to have a manpower link to be able to offload the job of finding a facility. And it's until you've had to sit there and someone is getting worse right in front of your eyes, and you're the one that's responsible and have to face family members and friends. I mean, it's unbelievable what that means. And I think a lot of times it kind of gets lost in the fact that we've got this whole state doing this whole thing, but it really comes down to one person taking care of one person, or a team taking care of one person and a family. It's a dynamic that we should never forget. So I'll show you a little bit, and this is, again, I'm gonna go to a different screen here for a sec, if I can do this with style. But this is what we're facing sort of statewide at a level of receiving hospitals. This is what the tertiary and quaternary care centers are. And if we even go down to what we classify as our tier 2, we're just seeing everyone is near or at capacity across the state. And this information comes from a variety of different directions, but it's all saying the same thing, that there's some areas that have capacity, and typically the smaller hospitals are starting to see that they have some capacity. I think it was pretty much nailed on the head when you start to say that the patients that we're dealing with on the COVID side, while they may not be as often, or the numbers may not be as high, the acuity is actually much higher than it's been. Certainly in Southwest Kansas, the median acuity these patients we're moving now is 15, which is a pretty solid number. I do think it's interesting that from an age range, the number of patients that are moving the age range is actually lower than a lot of other parts of the state. I think we are seeing people who are less sick, and that group is expanding, but we're also seeing a lot of people who are very, very sick, and they're vying for those critical ICU beds in the tertiary hospitals. And so they're quickly becoming the bottleneck right now. Those patients take 2, 3, 4 weeks of care and they occupy the bed for that long. It's not that these beds are turning over all the time. It's that you can't make more beds. Even though we're making more patients, you can't make more beds to take care of them. Wait times are actually pretty good in Southwest Kansas. We're not seeing the extensive wait times that we've seen in some of the other places. And certainly even we're under the 2-hour mark for most of the high acuity patients, which is good. We offload to Denver, certainly, and some other hospitals that some of the other parts of the state don't necessarily have immediate access to. So I think that's a good sign. And overall, I think everybody's got their eye on what does this Christmas thing mean? And we see testing numbers up, and we see number of positives up. Will it translate into hospitalizations, and how is that going to affect the system as a whole? And so I think we're all aware of what can happen here in just a few bad days. So I think we'll see. These next 2 weeks will tell the tale, and probably will be the story going into the spring. If we fill the hospitals and keep them full through January, that's not going to change even into March. And so I think we've got to be aware of that, and certainly we as communities are working hard to make sure that everybody hears the message to stay the course right now.
Thank you, Dr. Watson. Anybody have comments or questions there? Jeanette, Mary, or Teresa, or Tara, or Julia? Any questions or comments there? Okay. Mary sent me an article from the Garden City Telegram from this week, and highlights a lot of what we were hearing from our friends from Wichita County here. Just as the healthcare workers fight on despite fatigue, staffing shortages, and overwhelming death. And the bright spot is the people continuing to stand in the gap. One thing stood out to me. There's a doctor named Raul Lastimosa, or I may have gotten that wrong. I apologize if I did. But he's just talking about, people wondering if they should just quit or call it quits, and thinking about their colleagues and wanting to stay in it with them. Just talking about how emotionally draining it is, and talked about, when he would say goodbye to his wife, instead of saying, let's see, I want to make sure I get the quote right. Let's see here. We now tend to be closer to family. We used to say goodbye to our wives in the morning. Now that has changed into I love you. That's the new way of saying goodbye, because you're never sure if one of you will get the illness while you're trying to help people who need your help the most. And then he went on to say, we didn't just sign up for easy days. We embrace the hard days as well. And so, just people having that kind of courage. And we're seeing that in our 3 guests here on the call today. It's just a very real place and situations that they're facing on a daily basis. And we just appreciate your willingness to do it. and incumbent upon all of us to do what we can to support them, not just by encouragement, by the actions that we take to help stop the spread in our communities. So thank you all very much for being a part of this call. You can sign up again for an email at covid.ks.gov/report-outs and to be able to have these sent to you along with the dashboard. January is going to be a really important month as we wait to see what happens over the next 2 or 3 weeks from the holidays. We'll also give you vaccine information as we have it and report it out from these calls too. So hopefully we'll hear more this week along those sides. So every week at 4:00, Southwest Regional Report Out on Tuesdays. Everybody, Happy New Year, and thank you for being here. Thanks for everything you do.
Thanks, guys.